Good morning, Dr. Hrymoc. Thank you so much for taking the time to come be on the Meaning Project podcast and share your perspectives on addiction with my audience.
Good morning. Yeah, thank you so much for having me. Please call me Mark.
Mark, great. Well, Mark, I was going over your center's website and your information, and your experience in addiction is extensive. And really, I just wanted to dive into your perspective and well, what you know about what we're doing right and what we're doing wrong in working with addiction today.
Sure. Well, we're doing a lot of things right, certainly. I mean, addiction treatment, the foundation lies in AA, 12-step recovery, and that's been shown through research and millions of people's experience to really be helpful for treating addiction issues. And with advancement in modern science, medications have
Mhm.
also proven themselves to be useful too. And increasingly, with each decade, we're seeing more and more adoption of medication treatment, both for addiction and the conditions that underlie it that could predispose a person to developing a substance issue. Things like depression, anxiety, insomnia are all treatable medical conditions that do respond to medications. And we also have a whole bunch of other supports that are available, individual psychotherapy. Many people prefer to other forms of psychosocial treatment, which is what we would call, 12-step or any other talk type therapy, group therapies, so there's also a lot of understanding that, not it's not a cookie cutter approach, not necessarily the same approach works for every person that we do listen to the client slash patient and get a sense of what resonates with them and what they can buy into. So I think that's something also that's been working better and better as time passes. What's not working? I guess the specific causes are debatable, but definitely there are still relapses. There are still, a lot of conflict, struggle, false starts and stops in any person's trajectory towards recovery. And addiction is still a deadly disease, and people are still succumbing to it too. So clearly there's room for improvement there.
Do you feel in your experience we're dealing with more addiction or there's been an increase in recent times?
Definitely during the pandemic, there was a spike up. And in general, if you look at graphs of, the last 5 decades, let's say that there has been a slow, steady trend up. The last few years are looking more promising. So, but I think things can change and they go in either direction, every
Sure.
5 years or so.
When you say more promising, as in we've done better since the
Yeah, we've done
pandemic?
better. Yeah, lower incidences of addiction and overdoses and other statistics that we keep track of to measure the toll of addiction on our society.
Now, does your office, do you work in other forms of addiction? I mean, today we have obviously substance abuse and alcoholism and so many substances to become addicted to, but also the proliferation of pornography and online spending and gambling and things like that. Do you see similarities there? Do you work in those realms?
Sure. Yeah, we call those behavioral addictions as opposed to uh, chemical addictions or substance addictions, and they are mood altering behaviors analogous to mood altering substances. So you pointed out, spending, gambling, sex and love, screen addiction, are concepts. Not all of those are officially recognized by the DSM, the sort of the Bible of modern
Mhm.
psychiatry, but definitely clinicians in the field recognize these patterns, and we see that people are struggling with it. So I think it's just
Yeah.
a matter of time.
Um, with all, I mean, just off the top of your head, it was great to hear you list all the different possibilities for treatment, right? AA, behavioral, pharmacological. How should people go about discerning what might fit for them with all these possibilities available. What's the best way to go? How would you recommend somebody discern that?
In general, try everything if you're open to it.
Hmm.
Be an informed consumer of psychological, psychiatric services so that you also have an idea of what's out there. So I think there's like a education process that comes along with
Hmm.
what the treatment options even are. So if a person's open to it, trying a little bit of everything and seeing what they like, and if they're not sure, still keep trying it, and if they, usually after, let's say, 8 to 12 sessions of therapy is when we would say that's how much you need before you can even begin to judge, is this going to work for you? Is there improvement that's happening related to that? And likewise, 90 meetings in 90 days is like the standard AA recommendation. And so we're coming upon, this general recommendation of try things for like 3 months. Like 3 months is kind of how long you need to do something to really kind of get like a good, quote, dose of it. If we're going to consider this a treatment, like, that being the dose of the psychological treatment. And with medications, different ones have kind of different durations that they might need to be tried for before we can judge if they're working for a person or not.
I think that's such a good point. So many people, we live in a time of quick fixes, and the idea of 3 months to start doing better and feeling better can be a little overwhelming. But I think you make a great point. Try everything. Can be a lifelong issue for people, ups and downs, as you were pointing out. Um, but yeah, try AA me 90 meetings in 90 days. Boy, that sounds overwhelming for a lot of people. But once you get into it and find that there's connection and opportunity and growth. It works for a lot of people. Speaking of what works, what medications are you finding helpful for addictions treatment?
For alcoholism, the standard one, first tried often is naltrexone,
Hmm.
opioid blocker that comes as a pill form that's either taken once a day or there's a injection, long acting, that lasts 1 month called Vivitrol.
Hmm.
So that's a mainstay of treatment of alcohol issues. I still do prescribe antabuse,
Okay.
disulfiram, which people always, if they've heard of it, they always say, "Oh, that's the one that makes you sick if you drink."
Hmm.
And it's not supposed to make you sick because you're not supposed to drink on it.
Right.
It is supposed to act as a psychological deterrent to drinking, not a physical or aversive one. But for people who are motivated that actually take it, it is a useful medication, especially when their goal is complete abstinence.
Right.
Um, so for opioid addiction, Suboxone, Subutex is a useful medication. Buprenorphine is the active ingredient in both, so that, they are lumped together. That's really changed the game in the treatment of opioid addiction because it can be used to detox a person, even on an outpatient basis, which is where I work. I'm seeing people that come to me who are still working, going to school, and living their lives, but they have a outpatient visit with me. So with that, we can basically transition a person off of opioids, whether prescription or not, onto this medication, stabilize them, and basically then gently taper them down
Hmm.
to whatever rate is really going to be beneficial for them. Some people need
Hmm.
to stay on it for some time, as a maintenance treatment, just while they kind of get their stuff together in their lives and in their minds, establish proper psychological support and establish like a good foundation for which then they can later taper off of. But
Hmm.
naltrexone again can be used for opioid addiction too because it is an opioid blocker.
Hmm.
So it can reduce craving for opioids and even block the effect of an opioid if a person does slip too. So it takes away some of the risk associated even with a person who's having cravings to the extent that they relapse and slip. It kind of takes away the euphoria, the joy of what a person may otherwise experience with an opioid.
Yeah,
Um,
with the naltrexone. I was just working with a young man yesterday who was reporting, very good results. He was a two-timer in the old Dr. Dan men's substance abuse group, and this time around was more serious and really wanted to be sober. And he said the naltrexone was just working miracles for him. What, how does that work for somebody when we see so much alcohol addiction out there? How does the naltrexone serve to help people fight those cravings and to change their lifestyle?
Yeah, even though alcohol is not an opioid, its activity in the brain, especially its the euphoric buzz, the reinforcing part of alcohol is mediated by the opioid systems in a person's brain. And so by taking this medication, which is an opioid blocker, it just kind of tamps down on the activity of a person's opioid system. So it reduces cravings for alcohol. A person has less, thoughts of using, or especially if they're stressed or other things happen in their lives that can trigger cravings. There tends to be just less of those. And if a person does slip and even have some alcohol, it tends to block that euphoric buzz associated with alcohol as well. So it's just less reinforcing, to the extent that sometimes people say they might even pour themselves an alcoholic drink, take a sip, leave it on the counter, and then just kind of forget about it the way they might forget about like a glass of water or juice or anything else. So it really, really can remove the special salience of alcohol, we would say, the specialness of it. And so
Right.
on some level, it can become like just another beverage, So that's the goal. That's the ideal response. It doesn't exactly work that way for everyone, but
Mhm.
it can work that way for many people. And that's part of why we use it. It works for a lot of people.
This might be a little bit of a philosophical question, but what, in your experience, what is the difference between somebody who becomes an alcoholic or is an alcoholic and those that can drink well, normally or socially appropriately or in moderation? I mean, what differs there?
Yeah, genetics is
Mm,
definitely a big part of it. Addiction is more heritable than even standard mental health issues like depression or anxiety.
mhm,
For depression, anxiety, we say it's 50-50 genes and environment. For addiction issues, it's 60-40, with genes being the majority there. So, genetics are the majority of the reason, but the other 40% environment can come from adverse childhood experiences, so trauma, modeling also by parents or caretakers. If a child sees that a, adult copes with stress in their lives by pouring themselves a drink at the end of the day, or that's kind of how they unwind, that they do learn just through observation, that this can be used to cope with stress, deal with life, and then that does get ingrained. And I always think of the human brain throughout its development as kind of like wet concrete. And the younger someone is when they are exposed to anything, whether chemical or behavioral, as I'm describing, the more a chance of that imprint kind of lasting throughout the life. There's this actually fascinating stat about, cigarette smoking. If someone tries smoking cigarettes before the age of 14, they have something like 14 times the risk of becoming a lifelong smoker than someone who
really?
just waits until they're 18 and up, And so even that 4-year period in the mid-teens is a very kind of deterministic window in a person's development.
Wow. You said 14 times more likely?
Something like that, yes.
That's wow. Well, and that's, no wonder we have age requirements on purchasing and using some of these, but
Right.
I mean, in my experience, it happens sadly all the time. I know there's a large effort in my community to prevent kids from finding cigarettes and vapes and all of these things. And I, right, inherently, intuitively always knew, well, there's a good reason for it, but to recognize that that is that significantly greater chance of becoming a lifelong smoker is astounding. Wow. So Other is we were talking about Suboxone, naltrexone. What other forms of addiction are you seeing in your office out on the West Coast, or substances of abuse, maybe?
Yeah, I mean, honestly, alcohol and opioids are the big two. They represent 85% of addiction issues that I see.
Wow.
So, other ones that kind of make up the remaining 15%, let's say, cannabis is a big one. Even though it's not as addictive in terms of the percentage of people that ever try that actually meet qualifying criteria to be considered addicted is low, like around 9% compared to others are like 20 or 30% for alcohol, opioids, and things like that. uh there's so many people that are trying it, and now it's so readily available at
Mhm.
potencies that are greater than ever before that it does create significant issues for many people, especially young people in their teens and early 20s, just when the main mission in their life is to launch into their individual self and their way that's when they determine how they're going to form relationships in their lives and their career path or vocation, and a lot of socialization, their individuation as a person happens in those age. It can really hold a person back in that way. So other substances could be the stimulants, yeah,
Mhm.
methamphetamine, cocaine, other quote club drugs tend to be associated with those two. And in the background also is nicotine, cigarettes,
Sure.
vaping, are all widely used in people with people that have addictions even to other things. Just off the top of my head, it looks like three-quarters of people that are addicted to some other substance, the one that brings them into my office, the main problem substance, are also, using nicotine vaping, which
Right.
also takes its toll on a person's health.
Absolutely. What do you think about this trend of vaping? I don't know if it's still advertised that way anymore, but it was once advertised as the alternative to smoking, right? Use this to help get off of cigarettes. But in my experience, it's t- so much more harmful than nicotine or than cigarettes, sorry, tobacco.
Yeah, yeah. So it's it's all nicotine,
Mhm.
and cigarettes are clearly bad. Those have been around the longest, so
Mhm.
we society has proven to itself with research and just observation of the toll that can come from smoking and it being a carcinogen. Um, Vaping is probably not as bad, but still causes lung irritation. What I
Mhm.
always tell patients is your lungs were not designed as a drug delivery mechanism. They were meant to
Mhm.
take in air, extract oxygen, breathe out carbon dioxide, and that's all. But so yeah, definitely. And because vaping is so easy to do even indoors now,
Right.
and the limits on it are less. A person can actually end up vaping a lot more, the equivalent of a lot more than
Mhm.
with cigarettes. And I definitely have a lot of people when they tackle their main substance that's bringing them to my office to that then turn their attention to nicotine, and we ultimately treat it the same way. And there are medications used for that. Chantix or varenicline
Mhm.
is the best one that's out there in terms of its effectiveness. And there can be some side effects, but in general, people do tend to tolerate it well. And it's so good that I almost think of it as like if a person wants to quit, they will quit using this medicine. Like the main reason a person fails to quit using that is they aren't taking the medicine basically. And then yeah, nicotine replacement therapy, patches, gum, things like that. Still nicotine, still have that physiologic dependence associated with them, but don't really have the any other health consequences. Maybe raise blood pressure a little bit. It's sort of ironic that the nicotine itself is not actually all that harmful. What's unhealthy about it is the way in which people take it. So most dangerous being cigarettes, tobacco, even chewing tobacco,
Mhm.
and then followed by vaping. So if a person needs to stay on patches or gum, I say okay, as long as you need to, take your time. And usually they do come off it within a year or two. I also find that just helps in my building the relationship with the patient in terms of me not coming off as a nag or forcing them off of things. And, it just them being engaged in treatment is actually one of the most important things about treatment with me or any other health professional.
Yeah, I think that's such a good point for many of the people struggling with different kinds of addiction. It's often the cigarettes or the vape that are the last thing that goes like, hey, let's not try to do all of the changes at one time. Maybe just a little bit, moving forward. And as you said, try a little bit of everything treatment wise, but maybe even with cigarettes and vaping, it's a slower process for a lot of people. Um, Chantix, that's an interesting one. I was hearing about it a lot, maybe 5 or 10 years ago. Not so much these days. It kind of got a bad rap for a while because of its, potential side effects. What does that do to help people? How does that impact the brain to help people quit smoking?
Yeah, it was, you're probably not hearing about it as much because it's generic now. So that's a phenomenon in the US, when there's something as
Here we
brand
go.
name pharmaceutical companies advertise it. So you see it in print and TV and online, etc. But yeah, Chantix is again a really useful medication, helps so many people. And it works entirely analogously to the way that Suboxone, buprenorphine works for opioids. So it is, we would say, a partial agonist at the nicotine receptor. So that means it partially stimulates the nicotine receptor, stimulates it a little bit, not quite as much as nicotine, but stimulates it enough that a person doesn't go into withdrawal if
Mhm.
they are not taking in other nicotine. So it basically helps prevent withdrawal. And it's also very long acting in the system. And it also has a very high binding affinity. So magnetism or hold on the nicotine receptor. So I think of it as putting gum in a keyhole. Chantix is the gum that you can put in the keyhole, which is the nicotine receptor that even if there was nicotine floating around, it could not access the keyhole. It just blocks the receptor while stimulating it somewhat so a person doesn't go into withdrawal. And so it just almost like puts the nicotine system on ice. And, I
Mhm.
also kind of think of it that way. It just, if we think of addiction as like a daily cycle or even hourly cycle of a person using a substance and then it gets filtered out of their system, makes they crave it again and then they use it again. So they're on this kind of seesaw pattern throughout the day with their blood levels. And with Chantix, analogously buprenorphine, Suboxone, it just stays there and it's like at a very steady level. So a person can go on and do other things and they're not slaves to that up and down cycle that they otherwise would be.
Right, right. It's beautiful metaphor there. I love the gum in the keyhole one. I'm going to take that with me and use that in the office. That's a really good way to say it. You mentioned, okay, so nicotine in itself, not terrible for us, but it's the mechanisms by which we acquire it. Can you talk a little bit about that? In what way? What are the different ways that those mechanisms can harm us?
Yeah, so the route of administration of any drug or medication is relevant to a lot of different things. With
Mhm.
nicotine specifically, if we think of, again, the most dangerous burning tobacco, carcinogens are created, so that contacts your lips, your entire respiratory tract going from your lips to the bottom of your lungs. And so that's why we see cigarette smoking predisposing to mouth cancers and
Mhm.
pharyngeal cancers and cancer of the lung, obviously, too. And other forms, they have chewing tobacco, there's transmucosal absorption through the mucous membranes of your mouth, but that tobacco is still sitting there against your cheeks or gum, and so that's why the oral cancers have are increased in people that are chewing tobacco. And with vaping, it's still an irritant.
Mhm.
There's nicotine there. It's also unregulated, so we don't know what other industrial chemicals,
Right.
solvents, other things are actually in vapes, and they can vary across products, and there's no
Mhm.
standardization. So, because it's unregulated, we don't know exactly what the risks are. I mean, the assumption is it definitely causes bronchitis, like an irritation of the inner lining of the lungs. So that becomes relevant too. But then, yeah, if we just think of other ways, nicotine can be absorbed, like you just, yeah, pure chemical nicotine can be put in a patch, applied against the skin. So
Hmm.
transdermal absorption is, relatively harmless. And some also with like there's nicotine lozenges, nicotine spray exists. I mean, it's not as commonly used. Usually it's patches or gum that people are
Okay.
using. And so, that's just pure nicotine without the carriers, it's the kind of the carriers associated with that nicotine can cause, wreak some havoc on the system.
Okay. So this may not be socially appropriate, but I'm going to try it anyway because we see so much. I see so much of these the Zyn pouches, right? The
Right.
nicotine pouches. So if nicotine's not too terrible for us, does that mean these pouches, and I see them with kids so much, it's crazy, but does that mean those maybe aren't as bad, or are they still pretty bad for you?
Yeah, my understanding is Zyn does not contain tobacco, right?
Okay.
It's just,
It's
yeah.
just straight nicotine, yeah. I think, well,
So,
mostly nicotine. I don't know what else is in
yeah,
there.
there's also other pouches that do. And the ones, yeah, might need to actually just d double check about brand names and all. But if tobacco's in it, then it is dangerous. It basically
Okay.
ultimately equivalent to chewing tobacco. Pure nicotine on its own, if it's like, yeah, transmucosal absorption,
Hmm.
I would assume is actually the same as like a nicotine lozenge, which exists
Okay.
as a way of quitting nicotine too.
Interesting.
Yeah.
Interesting. Okay. Um, what I know on your website, it mentions using ketamine assisted therapy for addictions. I just yesterday completed a pretty extensive course in psychedelic therapy with ketamine as well as other uh, substances. What kind of results are you getting with the ketamine assisted therapy?
So to clarify, and I'm pretty sure our website doesn't specifically say using ketamine to treat addiction.
Oh, okay. Sorry.
Ketamine, I would say, is used to treat, yeah, mood issues, depression, anxiety, PTSD, that potentially can have all sorts of secondary consequences in a person's life. But ketamine is mainly a treatment for mood issues. There's definitely
Hmm.
research interest in it being used as a treatment for addiction. And there's even
Hmm.
some small studies suggesting that it could be helpful for alcohol and cocaine are the substances that there are small studies about.
Hmm.
But for the most part, ketamine is not in we'd say the clinical practice guidelines, the marching orders,
Hmm.
the directives that a doctor would actually use to recommend treatments to a specific person.
Okay.
But if a person happens to be in recovery and not using any substance, even though they may have had a history of using substances and still struggle with significant depression, anxiety, PTSD that could result in relapse, then an argument can be made that it can protect them from a relapse if we treat their primary mood issue. And it works really well, really quickly, but biologically and experientially, we would say. So it can make therapy more effective too. We've definitely had patients who say they've been in therapy on and off throughout their lives for many years, but when they have ketamine assisted psychotherapy, they feel like they get a lot more out of it. There's more potency there. Maybe they're even able to access thoughts, feelings, emotions that they can't access in their typical conscious state. And by being in that non-ordinary state that ketamine induces, it can help them address certain issues and have insights that they can then implement in their regular day-to-day lives.
Got it. So not necessarily specific for addiction treatment, but to treat as you said, the mood issues that may impact or relate to addiction, ketamine can be helpful.
Right.
Got it. Sorry for the
No worries.
mistake. Yeah, that makes a lot of sense. That makes more sense. So it's not
And,
ketamine directly for addiction.
and that statement is out there. And there are
Yeah.
definitely practitioners, websites that will, advertise using ketamine for addiction issues, but
Hmm.
I do feel strongly about, my role as a doctor being one where society trusts me, like the state of California gives me a medical license and trusts me to be, accurate with my words and portrayals. And so I do think it's really important to highlight that it's not any sort of standard treatment for addiction issues, but
Mhm.
for mood issues, there's a different story.
Absolutely. That makes complete sense. Thank you for clarifying that. Any thoughts? I know California, the West Coast in general, Oregon, Washington, really hotbeds for research in alternative medicines for moods and addiction. Um, any thoughts on that research? What is coming out of that area when it relates to the MDMA trials? Psilocybin is back up. Even I think it may be Colorado. I'm not sure about California, experimenting with LSD for different treatments. These are things that were used in the 50s and 60s that we're seeing reemerge. Any thoughts on those?
Definitely, yeah. There really does seem to be a new chapter opening up in psychiatry where many psychedelics are currently being studied for almost every single psychiatric indication, diagnosis, basically.
Mm.
So including things you wouldn't intuitively think of, like you said, LSD for the treatment of generalized anxiety disorder is actually like one of the biggest studies that's happening right now. And we
Really?
think of LSD, we think of people who may have had bad experiences that triggered anxiety, but yet, there's a big difference in context. The saying is set and setting, so your mindset going into a psychedelic experience and the setting, both in terms of physical environment and the people around you, actually are really important
Mhm.
in determining the subjective experience there. And so I think what it's really demonstrating with that specific trial with LSD for anxiety is that with the right foundation of good environment, supportive people around you, people even that you've met, and some of these studies actually have therapists as a part of it, and others don't. Others are kind of medication alone. So, but that can make something like LSD even potentially helpful for anxiety. So, it's not standard clinical treatment yet, and their research is still being done. LSD is still not legal for use in any sort of medical scenario, but there's definitely a lot of promising research with psychedelics. And yeah, psilocybin is the main one
Mhm.
now, it seems like, MDMA. There they did not get FDA approval last summer, and everyone was looking forward to that being approved. And basically, the FDA told them they have to redo a bunch of studies and um, do better next time, basically, for their next attempt at approval, which I'm sure will happen, but will be a few years from now. And psilocybin is the research that's coming out really does show it being a promising for depression primarily, and also to some degree alcohol use disorder, alcoholism. So, and many other psychedelics like DMT, 5-MeO DMT, ibogaine, are being studied for so many different psychiatric indications.
Yeah, a lot of great research going. I had no idea LSD was being studied specifically for anxiety. As you pointed out, that most people associate LSD with, a bad trip, bad, poorly chosen set and setting, maybe not having the right people around, and therefore inducing anxiety. I didn't realize we're looking at it for anxiety. That is uh, pretty interesting, quite spectacular. So, um, any further information on psilocybin for alcohol use? Is that specifically related to mood, therefore improved mood, maybe decreased alcohol use, or is there some other relationship there?
That's still being determined.
Okay.
When research on specifically any kind of psychiatric medication is done, it's very simple and basic, and it really just looks at a group of people that have a condition, and then they're either given the active drug or some placebo, and then we look at the outcome in terms of a few outcome measures, which can include sobriety, rates of relapse, or in the case of depression, like depressive symptoms, like low energy, low motivation, depressed mood, etc., suicidal thinking. So they're only looking at the before and after effects of getting a certain treatment. As far as mechanism that you're asking about,
Mm,
we can speculate,
right.
and a lot of these things, I mean, certainly with ketamine appears to have both biological actions as a medication, and even again, not all of the current psychedelic trials are incorporating psychotherapy. Many are just medication alone. So the medication can have a biological effect, but also there's probably an experiential effect. I mean, the experience of a psychedelic can be so profound. I mean, there are also stats where when people have a psychedelic, I think this one comes from psilocybin specifically, they will commonly rank it as one of the 10 most meaningful experiences of their
Right.
lives,
Right.
and a lot of these studies are showing beneficial effects that last 6 to 12 months, like well beyond even like the biological impact of a medication. And so, the thinking is that yes, there is something happening with a person's perspective on things, on themselves, on the world, and their role in it, and uh, and that all helps basically.
Yeah. Yeah. Well, interesting stuff that we'll be seeing in the future. Yes, I know a lot of people are disappointed by the failure of MDMA to be approved, and they're going right back to work to try to do it. I've heard stories of many, especially for veterans, going south of the border to Mexico for different kinds of treatment and coming back with excellent results, but not quite legal here yet. Soon.
Right.
Um, wow. We've been all over the place, just kind of, you've elicited a lot of good questions from me. Other things you want the audience to know, just things off the top of your head, or, sorry, I've been kind of leading this conversation, things that you wanted to share.
No, I appreciate your lead. Enjoy answering the questions too. Um, I mean, a big uh, cause that I really believe in and communicate to patients that I work with is to destigmatize the treatment of mental health issues. Even the people that are coming into my doors who've gone through their own process to, feel comfortable doing that. And I recognize there's a lot of people that suffer and struggle on their own without reaching out for help for a long time. But once they do come in and we start talking about things, I do notice stigma operating in the background, even people I've been seeing for years, and that's illustrated by people who may have had a successful round of treatment with some conventional antidepressant like Zoloft or Lexapro, let's say, and they're doing well for 2 years, and the issues that they came in with are no longer there. And I'm seeing them every 6 months, mainly just to check in and make sure everything is still going okay. But they do start asking questions like, when can I come off this?
Mhm.
And I don't want to be on this forever. And those are totally reasonable questions, and I, don't fault anyone for asking questions, but I have all sorts of patients asking this, and in psychiatry, the ones that have had just kind of one episode, the milder cases, those are the ones where we say, okay, after 6 or 12 months, we'll try you off it, see how it goes. At that point, there's kind of like a 50-50 chance of recurrence of their issue. But I also have people that have had, lifelong struggles with chronic and severe depression, pulling at wanting to come off their medications, which, I've seen them at their worst, and many times they'll tell me, yeah, I've been like this, like on and off since my teens, and my first visit with them might be in their 40s, and they have this recurring issue, and yet they still kind of have this idea in their mind, like they don't want to take a medication for a mental health issue. Taking a medication means that they're inherently weak or of poor moral character or some other, a lot of times unconscious uh, programming is operating in the background there. So I, really try to encourage those people that, look, you have a medical condition, just equivalent to high blood pressure or asthma, things that we may think of as having a pure quote medical basis. And, you know, before you had wheezing when you exercised with, and now you have an inhaler or other medicine, and, you know, you exercise and you live as if you don't have asthma. You know, likewise for depression, anxiety, trauma, if a person has recurrent, especially a severe history with that, the chances of a recurrence are 90% or more. And so we always weigh kind of the risks and benefits in medicine of continuing a treatment or not. And depression itself is so debilitating, and the medicines are so safe that it almost is a no-brainer to just kind of stay on the medicine. Think of it as a vitamin that you take every day for optimal functioning, and you live your life and you're doing well. So, you know, I think the stigma is still alive and well. And even in people who've bought into treatment with conventional psychiatric medications or other forms of mental health treatment, you know, really do struggle with that. So I think that's definitely a soapbox that I stand on.
Yeah, and I appreciate that soapbox, right? The destigmatization. Um, I love using the hero's journey metaphor for mental health and treatment. That, we've studied the hero's journey through mythology and ancient stories, and even great modern storytelling usually follows that path. That every hero has a mentor that teaches, gives them the lightsaber or the golden ring or whatever it might be. And, there's nothing wrong with, having that mentor, having, therapy on and off as needed, mentorship throughout life. But the same goes for that lightsaber, right? That medication from time to time that we may need to help us get over the hump, or for those who are struggling significantly or frequently, like yeah, it may be something that you have to keep an eye on, throughout your life to function optimally.
Right.
And so I definitely appreciate that perspective. Um, Well, hopefully you're enjoying a beautiful sunny day in LA. I know here in the Midwest we're dealing with gray and clouds again as we usually do. So I will thank you for your time and I mean just such a great perspective and in-depth knowledge. I love from a therapy perspective, it's great to have that kind of in-depth medical knowledge that you provided. So thank you. Thank you for the time today and sharing. Anything else you want to leave the audience with before we part?
Well, thanks for listening, and I really hope that you all are able to live fully to your highest potential, including personal relationships and work and physical health. And, you know, we all have that same challenge in front of us to really be all that we can be and make the most of our lives. So I hope each of you are able to do that in your day-to-day life.
Beautifully stated. Once again, thank you so much for your time. Take care.
All right. Thank you so much, Dr. Dan.